Relearning bowel and bladder control is time-consuming. It requires a great deal of patience and understanding, but when it's accomplished, it's very rewarding not only for the patients, but also for the staff. The patient is able to become more independent and will gain a great deal of self-confidence and self-respect. I'd like to describe, first of all, a typical bowel retraining program. There are a variety of methods to retrain someone who has had incontinence of bowel movement. This would be the components that would be a part of the majority of retraining programs that you might see. The first thing is that you must observe the resident's normal bowel pattern. As you know, some people have a bowel movement every day normally, some people every 2 days, sometimes every 3rd day. It's not common for us to have a bowel movement at the same time of day as well. So it's important to observe the individual and find out when they're having their bowel movement. The next part of the retraining program is that the patient is placed on a regular eating schedule, and they're generally provided with a high residue or high fiber diet. This diet contains a good deal of water. We're talking about 2 to 3 quarts of water or other liquids for the individual each day, unless for some reason it's medically contraindicated to give them that much liquid. Ambulation and exercises are also a part of a retraining program, particularly ones that would help strengthen the individual's abdominal muscles. The patient must have ready access to the toilet, must have privacy to be able to have a bowel movement, and part of the retraining program would have the individual placed on a regular scheduled time for a bowel movement. Typically that would be about 30 minutes after breakfast. Typical bladder retraining program, remember now, a bladder retraining program would help the individual regain control over their voiding or urination. Again, they must be observed for finding out how frequent they are urinating. And it could be every 2 hours, it might not be, but every 4 or 5 hours. So observing their normal pattern before starting the training program is key. Then the individual is typically toileted on awakening, toileted before meals and after, and then again at bedtime and at least once during the night. They too are provided with a daily fluid intake of about 2 to 3 quarts, again unless there's some medical reason why that would not be advisable. The exercise program that they might be placed on would be a program called Kegel exercises. Kegel exercises help exercise the pelvic muscles. The pelvic muscles are the muscles that we have that control the starting and stopping the stream of urine. By practicing starting and stopping as though you were going to be urinating, the individual strengthens those pelvic muscles. Frequently, they will tighten those muscles and relax them about 10 times for the exercise, and that might be done 4 to 6 times in a given day. There are also some support measures that need to go along with a continence control program. The person needs to be well groomed and have good personal hygiene during the retraining program, as with any other time. A person is going to have more incentive, feel more incentive to be continent, to work hard at not having these episodes of incontinence if they feel good about the way they look in the other areas of their personal hygiene and grooming. They should be dressed in their street clothes and shoes, not be allowed to be in nightgowns or pajamas through the course of the day. Encourage attractive physical appearance. Also involved in social activities. Indifference and lack of mental stimulation may lead to incontinence. Patients that are more likely to be incontinent are ones when they are isolated, ignored, or left unattended for long periods of time. Praise and encouragement during the retraining program is also important. Never show hostility or disapproval when an individual has an accident and wets or soils their clothing. Our facial expression, even if no words are uttered, send a very strong message of whether or not we are accepting them, regardless of whether they are continent or incontinent. Instead of showing hostility, give them encouragement to try again, and very likely next time you could be successful. You as a caregiver are key to a successful retraining program. When caring for patients that have had problems with incontinence, there's a few things that are important to remember. The first is answer call lights promptly. Keep assistive equipment within easy reach for the individual. That might be a wheelchair or a walker. Oftentimes, urgency is a concern in having a bowel movement or urinating. So having those things readily accessible may make the difference between them having an incontinent episode and making it successfully to the bathroom. Keep the path to the bathroom clear and well lit so that they might not fall in their transit. Until a retraining program is successful, special clothes protectors may need to be used. As a caregiver, it's important that you never use the word diaper. That word has association of being an infant or childlike. Neither one of those associations are appropriate when you're talking about adults. Instead, use words such as briefs, garment protectors, or underpads. I have some examples here that I'd like to show you. This is a disposable brief, and it has tabs that get put on the individual and secured. They come in numerous sizes, and you'll find out more about the appropriate sizing depending on the type of product that you use. This is also a brief that is not a disposable one. This has snaps instead of sticky tabs like the disposable one did. This one, when it becomes wet, does not get disposed of, but it is washed in the laundry and then may be reused again. These also come in different sizes, small, medium, and large. You notice that there's a soft cotton interior and there's an impermeable barrier that prevents moisture from going through onto their clothing or onto their bed. That's true of the disposable ones as well. This particular style is a panty as opposed to a brief. This is worn just pulled up like an under panty would be, but it is disposable, and if it gets wet